Question number 1. Which ion causes rapid depolarization in a neuron? Correct option is B. Sodium. Question number 2. Which organ stores excess glucose is glycogen? Correct option is A. Liver. Question number 3. Which giant allows the widest range of movement? Correct option is D. Ball and socket. Question number 4. Which artery mainly supplies the brain? Correct option is D. Internal carotid artery. Question number 5. Which hormone regulates the sleep-wake cycle? Correct option is C. Melatonin. Question number 6. Which vitamin is required for calcium absorption? Correct option is A. Vitamin D. Question number 7. Which cell release histamine during inflammation? Correct option is A. Basophils. Question number 8. Which heart layer is responsible for contraction? Correct option is C. Myocardium. Question number 9. Which of the following gland controls metabolism? Correct option is A. Thyroid gland. Question number 10. Which neurofibers carry slow chronic pain? Correct option is D. C. Fibers. Question number 11. Which part of the nephron concentrate urine? Correct option is C. Lobe of Henle. Question number 12. Which brain part maintains posture and balance? Correct option is D. Cerebellum. Question number 13. Which muscle type is involuntary but striated? Correct option is B. Cardiac muscle. Question number 14. Which organ has highest regenerative capacity? Correct option is A. Liver. Question number 15. Which phase of action potential is caused by potassium efflux? Correct option is B. Repolarization. Question number 16. Which hormone increases basal metabolic rate? Correct option is C. Thyroxine. Question number 17. Which nerve supplies the deltoid muscle? Correct option is D. Auxiliary nerve. Question number 18. What is the major buffer system of blood? Correct option is B. Bicarbonate. Question number 19. What is the normal hematocrit in males? Correct option is A. 40 to 50%. Question number 20. Which organ is affected in Addison's disease? Correct option is the adrenal cortex. Question number 21. Which hormone is secreted by pineal gland? Correct option is C. Melatonin. Question number 22. Which ion mainly determines a resting membrane potential? Correct option is D. Potassium. Question number 23. Where is the fire's pitches located? Correct option is A. Ilium. Question number 24. Which bone articulates with humerus at shoulder? Correct option is C. Scapula. Question number 25. Which hormone increases calcium excretion in urine? Correct option is B. Calcitonin. Question number 26. Which organ is the primary site of hematopoiesis in adult? Correct option is D. Bone marrow. Question number 27. Which hormone regulates circadian rhythm? Correct option is C. Melatonin. Question number 28. Which type of muscle is found in uterus? Correct option is B. Smooth muscle. Question number 29. Which hormone increases heart rate directly? Correct option is C. Epinephrine. Question number 30. Which organ detoxifies ammonia into urea? Correct option is A. Liver. Question number 31. Which gas is transported mainly is bicarbonate? Correct option is C. Carbon dioxide. Question number 32. Which part of the gastrointestinal tract absorb iron? Correct option is D. Duodenum. Question number 33. Which ion influx causes depolarization of neuron? Correct option is A. Sodium. Question number 34. Which bone is the longest in human body? Correct option is B. Femur. Question number 35. Which part of the eye contains rod and cones? Correct option is D. Retina. Question number 36. Which organ is most sensitive to hypoxia? Correct option is A. Brain. Question number 37. Which organ regulates acid base balance primarily? Correct option is B. Kidney. Question number 38. Which hormone causes vasodilation in pregnancy? Correct option is A. Relaxin. Question number 39. Which part of brain controls emotional behavior? Correct option is C. Limbic system. Question number 40. Which hormone stimulates gastric motility? Correct option is B. Motoline. Question number 41. Which organelle is most affected during hypoxia in cells? Correct option is C. Mitochondria. Question number 42. Which structure gives strength to the cell membrane? Correct option is B. Cholesterol. Question number 43. Which factor initiate intrinsic clotting pathway? Correct option is D. Factor 12. Question number 44. Which cranial nerve controls chewing? Correct option is B. Trigeminal nerve. Question number 45. Which hormone stimulates gastric acid secretion? Correct option is C. Gastrin. Question number 46. Which part of kidney is hypoxia sensitive? Correct option is B. Medulla. Question number 47. Which vitamin is essential for prothrombin synthesis? Correct option is A. Vitamin K. Question number 48. Which white blood cell is involved in allergic reaction? Correct option is C. Eosinophils. Question number 49. Which structure is functional unit of liver? Correct option is D. Hepatic lobule. Question number 50. Which ion influx trigger muscle contraction? Correct option is B. Calcium. Question number 51. Which part of the gastrointestinal tract absorb majority of nutrient? Correct option is A. Stomach. Question number 52. Which hormone stimulates renal sodium reabsorption? Correct option is D. Aldosterone. Question number 53. Which organ produce erythropoietin? Correct option is D. Kidney. Question number 54. Which part of the brain controls voluntary movement? Correct option is B. Motor cortex. Question number 55. Which part of the neuron release neurotransmitter? Correct option is C. Axon terminal. Question number 56. Which structure prevents reflux of bile? Correct option is D. Sphincter of Oddi. Question number 57. Which nerve carries parasympathetic fibers to heart? Correct option is A. Vagus nerve. Question number 58. Which white blood cell is first in infection site? Correct option is D. Neutrophils. Question number 59. Which hormone increases blood glucose? Correct option is C. Glucagon. Question number 60. Which hormone inhibits growth hormone release? Correct option as D. Semestotene. Question number 61. What is a sign of pulmonary hypertension? Correct option is B. Loud S2. Question number 62. How is atelectasis prevented after surgery? Correct option is B. Deep breathing. Question number 63. When is a Heimlich maneuver used? Correct option is B. Chalking. Question number 64. Where is emphysema damage located? Correct option is the alveoli. Question number 65. Which finding suggests TB reactivation? Correct option is B. Hemoptosis. Question number 66. Which urine specific gravity indicates dehydration? Correct option is C. 15030. Question number 67. Which drug must be avoided in renal failure? Correct option is a non-steroid and anti-inflammatory drugs. Question number 68. What is the severity in severe diarrhea? Correct option is C. Hydration. Question number 69. What is the severity in hematomesis? Correct option is B. Oral fluids. Question number 70. What causes bright red blood per rectum? Correct option is A. Hemorrhoid. Question number 71. Where is progesterone primarily metabolized? Correct option is B. Liver. Question number 72. When does cervical mucus become thin and watery? Correct option is B. During ovulation. Question number 73. How does estrogen level falls during menopause? Correct option is A. Gradually. Question number 74. What is the function of primary and ovulation? Correct option is A. Capture ovum. Question number 75. Which hormone increases vascularity of endometrium? Correct option is B. Estrogen. Question number 76. Which hormone inhibits follicle stimulating during luteal phase? Correct option is C. Inhibin. Question number 77. Where does the majority of oocyte maturation occur? Correct option is A. Ovarian cortex. Question number 78. Which hormone peaks just before ovulation? Correct option is B. Luteinizing hormone. Question number 79. Where does estrogen exert neuroprotective effect? Correct option is B. Hippocampus. Question number 80. What is the primary function of inhibin in females? Correct option is B. Suppress follicle stimulating hormone.
Question number 81. What is the normal body temperature in Celsius? Correct option is C. 37 degrees centigrade. Question number 82. Hand washing is most effective method to prevent. Correct option is B. Infection. Question number 83. Which pulse site is used during CPR in adults? Correct option is C. Carotid pulse. Question number 84. Which artery is used to measure pulse in infants? Correct option is B. Brachial artery. Question number 85. Which temperature route is most accurate? Correct option is C. Rectal route. Question number 86. Which position is used for vaginal examination? Correct option is A. Lithotomy. Question number 87. Which infection controls method destroyed all microorganisms? Correct option is B. Sterilization. Question number 88. Which pulse is used in unconscious patients? Correct option is B. C. Carotid pulse. Question number 89. What is the normal oxygen saturation in healthy adults? Correct option is C. 95 to 100%. Question number 90. Which term describes high body temperature? Correct option is D. Hyperthermia. Question number 91. What instrument uses suction in delivery? Correct option is A. vacuum. Question number 92. What condition causes endometrial tissue outside uterus? Correct option is C. Endometriosis. Question number 93. What is the transverse diameter of fetal skull? Correct option is biparatal. Question number 94. What symptoms suggest ectopic pregnancy rupture? Correct option is C. Severe pain. Question number 95. What condition causes fetal distress due to low oxygen lack? Correct option is D. Aphaxia. Question number 96. What injection prevents RH incompatibility? Correct option is A. Anti-D injection. Question number 97. What cervical dilation rate is expected in active labor? Correct option is A. 1 centimeter per hour. Question number 98. What is the most common ovarian cancer type? Correct option is D. Epithelial. Question number 99. What measurement eliminates fetal growth in uterus? Correct option is a bundle height. Question number 100. What bundle height is expected at 28 weeks of gestation? Correct option is C, 20 centimeter.